This is the Wizard News.
The sky is bright and all the roses are in bloom. Strutting down the street like I'm walking on the moon. The bells are ringing, you are wondering for whom. When you're waiting for the end of the world, the taste of honey lingers on your tongue, and bitterness rests on your lips like some unseemly pun. Ain't it fun? All the butter and the guns. When you're waiting for the end of the world.
The World Health Organization, WHO, said on June 7, 2024, that it was awaiting the full genetic sequence data after a man died of bird flu in Mexico in the first confirmed human infection with the H5N2 strain. No further infections linked to the case have been detected thus far, said Aspen Hammond, a technical officer at the UN Health Agency's Global Influenza Program. The characterization of this virus is still underway and genetic sequence data should be available soon, Hammond told a webinar. H5N2 viruses have been detected for a long time in birds. The 59-year-old, who died after developing fever, shortness of breath, diarrhea, and nausea, had no history of exposure to poultry or other animals, and had multiple underlying medical conditions. The resident of the state of Mexico on the edge of the capital was hospitalized on April 24th in Mexico City and died the same day. It was the first laboratory-confirmed human case of infection with an influenza A H5N2 virus reported globally, the WHO said. Mexico's health ministry said that the victim had a history of chronic kidney disease, type 2 diabetes, and long-standing systemic arterial hypertension. There is no risk of contagion for the population, the statement said, adding that all samples from identified contacts of the patient have been negative. Authorities are monitoring farms near the victim's home and have established a permanent monitoring system to detect other cases in wildlife in the area. Mexican health authorities reported the confirmed case to the WHO on May 23rd after conducting laboratory tests. The source of exposure to the virus was currently unknown, although cases of H5N2 has been reported in poultry in Mexico. The risk to the general population is low, the Geneva-based agency added. A different variant of bird flu, H5N1, has been spreading for weeks among dairy cow herds in the United States, with a small number of cases reported among humans. None of them are human-to-human infections, with the disease instead jumping from cattle to people. There is no specific vaccine to prevent infection from the avian influenza virus. Candidate vaccines have been developed as part of pandemic preparedness. The WHO indicates that it has concluded agreements with 15 vaccine manufacturers to have real-time access to around 10% of the production of future vaccines in the event of an avian flu pandemic. Doses would be distributed to countries based on public health risks and needs. Source: Agence France-Presse and Science Alert, June 7th, 2024.
It's okay